Hello beauty lovers, I'm back with you on how to use a microdermabrasion part 2. This is where I'm actually going to demonstrate on how to use microdermabrasion machine or device or gadget that you have at home. I am a licensed professional, so I always say that microdermabrasion has to be done by a professional. So I suggest you all that you go and find a licensed esthetician or licensed practitioner that is qualified to do a microdermabrasion treatment on you. That's the best way to do it. And for those of you that want to do it at home and have no way of getting to an esthetician and need to get a microdermabrasion or bought a microdermabrasion device, and want to experiment with you, so let me at least help you out and give you some pointers on how to do it properly so you don't damage your skin, and that's the most important. So when I say damage your skin, how can you possibly harm your skin with a microdermabrasion? You can. One of the things is that it has a suction in it, right? That's one of the options in there, and it's not actually an option, it's built in. So the minute you turn on a microdermabrasion a gadget, especially the home use, the suction starts to work. You don't have a way to separate, but hopefully you will have the way to turn the suction down. So I wouldn't even buy a device that has a microdermabrasion tip where you cannot turn the suction down, okay? This is for those of us that have maybe thinner skin, more fragile skin, compromised skin, acneic skin, a skin that doesn't need a lot of suction. So because you can't, or those of you that have rosacea, broken capillaries, and things like that, and you're prone to broken capillaries, so you don't want to create a lot of suction for your skin because it will break another capillary, okay? It can actually give you a bruise. So for those of you that are on blood thinners, for example, be careful with the suction option in the microdermabrasion because it can give you a bruise, okay? Another part is that if you are on any chemical products like retinol, glycolic, and so on, and they are in your home care products, be careful with microdermabrasion because your skin is already exfoliated and sensitive, so you can actually cause scratches on your skin. So again, what does that is being aggressive with the actual handpiece, with the actual diamond powder, or choosing the coarse tip. We talked about it in the overview of microdermabrasion, or turning up the suction part of it. So not good. You can definitely damage your skin. So be gentle with it. I mean, you already have it at home or in your professional setting, so that means you can repeat the treatment. You don't have to do anything aggressive. Just by doing it properly, we are already causing micro trauma to the skin, healthy micro trauma to the skin. We don't need to add to it, okay? Don't overkill it. That's not necessary because it'll take your skin longer. Remember that longer to heal, and then remember that once you have damaged your skin once, your skin will always be on guard. So it can now overreact with anything that you put on your skin. So the last thing you want to do is cause sensitivity to your skin, okay? So let's talk about how we need to do this. Number one, like I said in the overview, your skin has to be completely clean, free of any makeup, free of any residue. That means that you have to do your cleanser procedure, okay? Once, if you do have makeup on, then you have to use your makeup remover or a topical cleanser. That's usually your milky cleanser. And then secondly, you have to use your foaming cleanser. Why? Because foam breaks down fat. Foam breaks down fat. That means all the fatty film that's on your skin will be washed away, and that's what we need. We need the skin to be completely dry. Okay, now once that is done, one of the questions my clients usually ask me, how do I prepare my skin for microdermabrasion? Can I exfoliate before I do microdermabrasion with my product? Okay, you can. It's okay to do. Just make sure it's not an aggressive scrub, because you're about to perform an advanced procedure. So no need to do anything aggressive with it. Okay, light scrub you can do. You can do a very light enzymatic solution, very light. So you can do something light, but then make sure that your skin is completely dry. So once your skin is ready, this is what's important when you're actually performing microdermabrasion. Okay, I'm going to turn my machine on. It's a little loud, so I'll speak a little louder, and because it's my industrial machine. So my machine is on. So I do have on my device, I do have the option where I can turn down the suction, and that's important. So I already kind of tested it on my skin just to make sure that it's appropriate on my skin, appropriate suction on my skin, and I'll close myself a little bit closer to the camera so you guys can see. So what's important is that one of the important things is to hold your skin taut. Okay, so you want to hold it, even stretch it a little bit, not too much, but a little bit, right? So you're going to apply the hand piece to where you can feel the suction. So when you pull a little bit, you can feel that, you know, your skin is caught in the suction. Then you're going to stretch and move. Okay, move. So what you're doing is you're moving from one finger to another. See, by holding it too long, I already gave myself a little bruise here. So be careful. Like I said, microdermabrasion can be really aggressive on your skin, and it can cause harm. So you have to be gentle with it. And actually, I'm gonna turn it a little more down because I tend to play with it too much. Okay. All right. So start moving from one finger to another. One finger to another. Try to do smaller strokes. Okay, you want to use microdermabrasion handpiece up, okay, to the side, up, not down. So you don't want to drag it down. Again, you don't want to cause more aging, right? By pulling your skin down, you want to move everything up. Okay, so there you go, moving it up. And then kind of twist it a little bit so you're gently removing the handpiece off the skin. So a lot of people I see, especially on some videos, what they do is they don't even hold the skin. They drag the skin like this, and they, you know, give themselves a little bruise. Not good. Just like what I did here. Okay, so you don't want to do that. Again, light from finger to finger, finger to finger. And when you want to lift it off, don't just pull. You want to kind of just lift it off like so, okay? Or this finger, the holding finger, can actually help you do that. Okay, when you hit the finger, it just lifts off. So do small sections. Again, small sections. Okay, in home, you see how it already gives me some redness, which we want. It's okay, because remember I told you, so when you're working with the suction, it's going to bring the blood circulation into the skin, and it will cause some redness, and that's okay, because after microdermabrasion we usually put product on that will calm the skin down, that will nourish the skin, hydrate the skin. So it's actually, it's a good thing that there's a little bit of redness. We want a little bit of redness going on. Okay, so how much do we go over the same area? I'll just say that if your skin, I'll go ahead and turn it off. If your skin is sensitive, then you only want to go over it once. Okay, at home. I'm talking about home care. So once over the entire face. Try not to overlap your patterns, okay? You're doing it smaller sections. Always the other hand and the two fingers are always stretching the skin, okay? Make sure you control your suction. As soon as you get closer to the eye, drop down the suction even more, because this is where we have very thin skin, and you can cause a bruise, you can cause scratching there, and scratching can also happen from repetitive strokes over and over and over again. It can give you a scratch. So be careful with microdermabrasion. It can harm your skin, but if you do it properly, then it gives you a beautiful, beautiful exfoliation. So around the eye, we're going to go, you can go outward, or inward, as long as you hold the eye and stay on the bone. So as soon as you don't feel the bone anymore, that's not the place for microdermabrasion, okay? If you're getting it done by a professional, then the professional can decide if they want to go that close. But by the book, we don't go beyond the bone, okay? Because the skin is too fragile for us to apply suction with so-called sandpaper in it, okay? Not necessary. You can go over your brow back and forth, because we do collect dead skin inside the brows. There's hair there, so there's bacteria. There's also dead skin build up there, so you can go over the brow, okay? Just be gently. Again, forehead will be same thing, holding the skin. You're going to go to the side, you can go up. So for those of you that have normal skin, thicker skin, you can go over twice. But what I would do, if you went this way, now try to go upward, okay? So give it different directions of rolling the microdermabrasion over your skin, only because dead cells sometimes are like protrusions, and sometimes you may not get them the first time going one direction. So try a different direction, and then you may slough them off that way. You can seed, but it's a known factor that they're like little protrusions sticking out from your live skin. So try to do it in one pattern and then change the pattern in a different direction to get your dead skin off, okay? And then do it over the entire face gently. Once you are done, you can change. By the way, changing, if you see that your tip now is a little dull and you can't even see the powder anymore, that means it needs to be changed. You can change the tips, and I always do, during the same treatment, even on yourself. If you see that it's already kind of dull and matte and you can't even see the glow of the powder, change the tip, okay? Get the next one, and then continue rolling over the face. And then pick, remember you have different sizes, a little one to go around the nose. You know what, I've seen a lot of times, I've seen blackheads flying out and congestion, all kinds of things are collected inside the tip when I start to wash it. So it's definitely a great way to extract some of the congestion from your pores too, especially if you drink water and your pores are very flexible. Microdermabrasion can also extract a lot of the congestion from your pores as well. So remember to change the tips, okay, during the same treatment, whether you're doing it professionally or at home. And if you do have only one tip, then technically you're gonna have to take it off, wash it. I like to wash my tips with a little either have a separate brush, kind of like a toothbrush. It has to be coarse, or a mascara wand, okay? Those little mascara ones, like the mascara, disposable, or you know, any type of brush would do, coarser brush. Okay, so make sure you kind of like when you're brushing your teeth, the same thing, you're going to brush the tips with antibacterial soap, and then you can put it back on, dry it, put it back on, and continue that if you have only one tip. But if you have multiple tips, then go ahead and you know, reuse them, not reuse them, but change them, so you can use a fresh one on the skin. If you deal with a lot of dead skin, then for professionals especially, try to take a soft brush, and as you're exfoliating, just brush off dead skin. So that will also help you, so you're more effective, so you don't go over, you know, dead skin that's piled up, and you know, you're just kind of an ineffective circle that you're performing here. So make sure that every time you're rolling it on a clean and dry skin. So once you're done, you can go ahead and stop your machine. The first thing you do before you clean is that you can rinse your skin with cooler water, and then you can also hydrate your skin with a toner, floral water, you know, and after that it's ready for absorption of nutritious products like a mask or a serum, moisturizer. So the all of the above would be good too, because your skin is now ready to penetrate some goodness, and that would be a good nutritionist mask. It would be you know, actually it would be a good way now to perform your facial massage with the light oil that's non-clogging oil, and or do a mask. So you continue doing your facial for yourself, or just finish with a toner and a moisturizer, and you're ready to go. So then what you want to do is you definitely want to wash, because now with dead skin on your tip, it collects bacteria. So you definitely don't want to just leave it or rinse it with water. You actually want to use an antibacterial soap if you're at home, even spray it with alcohol, leave it for about 10 minutes, you know, and rinse it again, let it dry completely before you put it in the container or in a Ziploc bag or wherever you're holding your tips. Okay, so make sure everything is sanitized, sterilized, and dry before it goes back into a container or back into the box where you keep your machine. Okay, so remember that you can put comments, questions. You can always write to me at myadorned@gmail.com. You're welcome to email me any questions or write comments down on the bottom. Subscribe to our channel, and remember, if you're the company that would like for us to demonstrate your device, you're welcome to contact us by email, and that's it. So thank you guys, and I will see you again for more videos. Take care.